Question 411. Nail and foot care are essential in meeting basic hygiene needs of clients. Important assessments by the nurse in this area include A. All-body assessment including the feet and nails. B. The essential lab work of the client. C. The nail beds and the tissue surrounding the nails. D. Foot cones and calluses only. Answer C. Explanation. The nail beds and the tissue surrounding the nails should be assessed for abnormal discoloration, lesions, paranoia, tissue dryness, breaks in the skin, pressure areas, or other abnormal appearances. Basic hand comfort. Question 412. All of the following clients are in need of an emergency assessment except A. bleeding client who has an injury from falling debris. B. An unresponsive client. C. A client with an old injury. D. A pregnant woman with imminent delivery. Answer C. Explanation. The client with an old injury does not need an emergency assessment because this is not a life-threatening or new situation or condition. Safety and infection control. Question 413. For which condition might a client's antidiuretic hormone AD8 level be increased? A. Diabetes mellitus. B. Diabetes insipidus. C. Hypothyroidism. D. Hyperthyroidism. Answer B. Explanation. ADH level is increased in the client with nephrogenic diabetes insipidus, reduction of risk potential. Question 414. A nurse is caring for a client with an elevated cortisol level. The nurse can expect the client to exhibit symptoms of A. Urinary excess, B. Hyperpituitarism, C. Urinary deficit, D. Hyperthyroidism. Answer C. Explanation. High levels of cortisol can produce sodium and fluid retention and potassium deficit, thus creating urinary deficit. Physiological adaptation. Question 415. What is pica? A. Dependency on alcohol. B. Increased iron in the diet. C. The sickle cell trait. D. Eating ice. Answer D. Explanation. Pica represents the ingestion of non-food substances that leads to a clinical iron deficiency and might actually be the first sign of a problem. Clients eat a wide range of non-food items, including ice, clay, dirt, and paste. Physiological adaptation. Question 416. The nurse should utilize data about which of the following to provide information about the nutritional status of a client being evaluated for malnutrition. A. Triceps skin fold measurement. B. Fasting blood glucose level. C. Hemoglobin A1C level. D. Serum lipid profile results. Answer A. Explanation. Objective anthropometric measurements such as triceps skin fold and mid-arm circumference (MAC), along with weight, are usually used to diagnose malnutrition. While all the other choices represent tests that might provide useful information, they also might be affected by variables other than malnutrition. Physiological adaptation. Question 417. When assessing a client in the emergency department whose membranes have ruptured, the nurse notes that the fluid is a greenish color. What is the cause of this greenish coloration? A. Blood. B. Meconium. C. Hydramnios. D. Caput. Answer B. Explanation. Greenish amniotic fluid passed when the fetus is in the cephalic presentation might indicate fetal distress. A fetus in the breech presentation passes meconium due to compression of the intestinal tract, physiological adaptation. Question 418. Which of the following is an indication for electroencephalography? A. Paralysis. B. Neuropathy. C. Seizure disorder. D. Myocardial infarction. Answer C. Explanation. Electroencephalography is indicated for assessing clients with a seizure disorder, reduction of risk potential. Question 419. Which of the following statements by client indicates adequate understanding of preparation for electroencephalography? A. I cannot eat or drink after midnight. B. I need to wash my hair before my test. C. I need to remove metal jewelry. D. I cannot take aspirin before the test. Answer B. Explanation. The client needs to wash his hair to remove hairspray, cream, or oil that might interfere with attaching the electrodes to the scalp. Food or fluids do not need to be restricted, with the exception of caffeine-aided fluids, where there is no restriction on mental objects. Aspirin is not a medication that needs to be held before the test, just anticonvulsants, tranquilizers, barbiturates, and other sedatives. Reduction of risk potential. Question 420. Client room environment should include A. A mailbag, fresh water, thermostat regulation, and clean floors in all occupied client areas. B. A made bed, comfort and safety, a clutter-free area, hygiene articles nearby. C. Accident prevention, comfort, a room that has been cleaned with chloroseptic wash, a bed that is made every other day. D. Odor control by spraying the room with deodorizers. Closet storage of all client objects. A clean room. Gloves should be worn when cleaning. Answer B. Explanation. Preparing client's room environment should include making the client's bed, ensuring comfort and safety at all times, keeping the area free of clutter, and keeping the client's hygiene articles nearby. All procedures should be explained before they are performed, and the client should assist with personal arrangement of articles, basic hand comfort. Thank you for watching.